Great. Second agenda item is the continued show cause hearings for properties under order to connect to the municipal sewer. Meredith, can you give us a brief introduction?
Yes, so the board is going to now conduct our continued show cause hearings for properties in Phase 1 of the sewer project. The date of compliance for these Phase 1 properties was March 16th, 2025. We have one continued hearing today, and it's going to follow a similar format to the previous hearings where the property owner representative will have an opportunity to share any updates, and then the health department will follow up with any other relevant information.
All right. Thank you very much. Good afternoon. My name is Joe Hartung, and I'm calling the show cause hearings to order for April 16th, 2026 at 2:01 p.m. Hearings are conducted before the Board of Health pursuant to the authority granted under Massachusetts General Laws, Chapter 111, Chapter 185, Board of Health Regulations, and the Sewer Use Rules and Regulations, fourth revision, revised November 2024. Purpose is the hearings is to determine whether there's sufficient cause to take action regarding Phase 1 sewer connections for each property in that phase that is not yet connected to the municipal sewer. At this time, we'll proceed with the continued hearings. 8 Old Tote Road.
So I don't believe we have anyone attending today for this property. I did get an update from the engineer Drake that plans have been submitted to AECom, which is exciting. And he heard back from the licensure engineering board, and he just needed to send one more document in. So I think he's made some progress.
Good.
More progress than they've made all year.
I would say multiple years. So we should continue this because they're getting close. When is our next?
Finding that sufficient progress has been made, I would move that we continue this hearing to,
Pulling the calendar.
The next first meeting in
May 7th or May 21st? Do we have any? I don't want to continue it to May 7th if this is the only one. Not that it's
Are
a
there any
big deal,
others
but
that we're
there
looking
are.
at? This is the last one that we have to deal with?
It's the last immediate one. There's a couple more that have been continued, I believe, past the summer. The one that had, we were waiting on Eversource, like Finley.
Yeah.
There's a couple like that, but there's not any on the agenda in May yet.
Okay.
but for the most part, those have been sufficiently responsive, and we understand and are sympathetic with the holdups on those.
Mm-hmm.
All right, then, I mean, May 7th, is that?
That's 4 weeks?
Yeah.
Yes.
Just the
So continue to May 7 at 2 p.m.
Second.
All in favor?
Aye.
Aye.
Okay, we'll now continue the show cause hearings to May 7th, 2026 at 2 p.m.
Moved by Sims, second by John Smith.
Thank you. Okay. That's it, great, 1. Agenda item number 3 is a pool fence variance for 7 Doan Road. All right, please come up. Introduce yourself, tell us why you're here.
Can do. Great to meet everyone. My name is John Stott, and I'm a resident at 7 Doan Road in Orleans. We've been there for about 5 years. We are in hopes of putting in a pool on our property. I've got twin boys who are 11 years old, so there's been a request, a long-standing request for one, so we're finally there. But given where our property sits relative to the septic system and the street, we're here for a variance of about 10 feet in order to actually keep the pool as close as I can to the center of the property. That, by doing so, would require a 10-foot variance to the right-hand side of the pool if you're looking at the site plan, such that we can keep the fence as close to Nauset Heights Road as possible. That is the real crux of the need for the variance. Otherwise, the pool fence will actually be closer than 20 feet on every other side of the pool, as designed today.
Did you notify abutters for this?
I did. I sent 8 certified mail letters to all of the surrounding property owners. I think it was 12 days in advance.
Okay.
If we give it a little space.
If you can send me a copy of the addresses, I just want to put it with my packet material. I don't know if it may have made it to me, it's just not made it off the printer.
I'm sorry, but we will get that to you. So that-
There are butters present. Butter, okay, we'll call you up momentarily. Comments from the board?
A couple of questions.
Sure.
Okay, so, there's only one gate going into the pool area?
There's 2 gates.
2 gates. Where's the other gate? Not here on the little drawing that you,
As proposed by the pool installer, if you're looking down on the property, such as the pool is running in parallel with Nauset Heights Road,
right?
there'll be a gate coming off the back of the garage. And there'll be a gate, sort of kitty corner, that would give you access from the back of the house.
On the back of the house, okay.
So by where the tank is shown,
Correct.
see the
I
swing?
see the one for the, yeah, by the tank. I was just looking for the other one. So that would be the one going into the back of the garage area.
Correct.
Okay. Both of those gates would be alarmed?
Yes, both of those gates will be alarmed. There'll be automatic closing. I would note that the property access points to the backyard where the pool will be have alarms that go off in the house. And there's pre-existing cameras in the backyard.
There are cameras in the backyard? Because I was just wondering how many windows and how visible is the pool area from the house itself?
Yeah, it's a great question. So if you're looking on the second floor, I'll start there. The bathroom in our master living space has 3 windows that look into the back. If you're looking on the first floor, the guest and bathroom, so those are actually 8 windows down there, because there's 2 rooms in the back, and then 2 in the bathroom.
Okay. In your notes, you did say that you had the 2 sons, and it was probably going to become a magnet for other kids in the neighborhood.
Yes.
So I was just wondering, are there any other safeguards, like an automatic pool cover or a flotation device in the pool to help with alarm conditions if someone accesses it when they're not supposed to?
So, given that this is not our permanent residence just yet, down the road it will be, we're putting in a auto cover,
Okay,
at least,
Yep.
to prevent that when we aren't home.
excellent, okay. Thank you very much.
Of course.
Any other comments from the board, questions?
Mr. Smith asked all my questions.
It was-
Mr. Smith asked all his questions.
President Butter, do you have anything you wish to add? Ask her. If you do, you can come to the podium and identify yourself, and the floor will be yours.
Bruce Schofield, Nauset Heights Road, Nauset Road. I have no problem with the pool being put in. The only problem, of course, is you have to look down your future, because eventually all these houses on Nauset Heights are gonna be hooked up to the sewer. All you guys here are gonna be dead, to be honest with you, no offense, but that's the truth.
I'll be here.
Only in spirit.
If I don't get stung by a yellow jacket.
But that's the truth. I mean, you also have to look, how are they gonna hook up to the system if it does come in many years, if he's gonna be using this as his home property later on down the road. So that's something to consider. I'm not opposing the thing. Also, there is a lot of kids in the neighborhood. Obviously, there are people gonna jump over the fence, and go in late at night at 3 o'clock in the morning, and all that sort of thing, so.
Auto cover.
His insurance is gonna go up, of course, so with the liability insurance and all that aspect of it, so that's not my problem, that's his, that aspect of it, that's all. Where I am, it won't bother me at all, whatever, because I'm up on the road by 5, Nauset 5 Doneway in that area. So I don't know why I even got a letter, because it's.
Want to make sure we had everyone
We
covered.
did, we did.
So it's, we're not really quota butter. My brother is, and also my niece, and that's why I'm here regarding that, because we got some information that it may have been next door with the property that was just sold by Mrs., I forget now her name, she's not, Mrs. Anderson, who was there, and all that sort of thing. And we thought that was gonna be on her property, not his property.
Okay.
That's the whole thing, so I just wanted to know what the whole situation was gonna be and everything. Point two is that when he empties the water at night, during the fall and all that sort of thing, or the winter, he's not gonna have that frozen over and all that sort of thing. Where is that water gonna go? You know,
You'll,
that's the concern I have, because there is a swimming pool up in the hill where he just lets it go down the hill, down that way, which,
There's a dry well proposed on his plans that show where the water will go on his property.
when he,
It's an actual dry well where it drains into it.
when it goes,
we're adding a 500-gallon dry well will be in the corner of the property such that any runoff whatsoever from the pool will go into that
are
area.
dry wells now allowed in Orleans?
Well, it's not for,
Disposal for waste from the,
yeah, for clean
Household
water.
waste.
It's
Yeah,
not household waste.
okay, all right, okay.
That was a great question.
Just to clarify one thing, this particular property is not on any plan currently for the town of Orleans to ever be sewered. So I just wanted you to be aware of that.
Stay tuned. I mean, we're in 515 or whatever it is. They're coming.
That's 16 phases
See,
through
yeah, well,
2067. So I-
2067.
As I said before,
2067.
everybody here will be.
I'll be almost as old as John. I think that, just real quick, I'm just kidding, John's much younger than that. Just for the point about the safety, our variance is for a 20-foot pool fence, so if he puts a 20-foot pool fence, a pool fence within 20 feet, we can't say anything.
Right.
We do ask for more safety proposals when you put the fence a little farther away. He's putting the most safe thing you can do, which is a pool cover. Every other town in the Commonwealth allows you to not even have a fence if you have a pool cover. So that you can, most of them now, you can actually walk, I wouldn't recommend it, but you can walk across them.
The one we'll have is, you'll be able to walk across as
Yeah, they're-
my size, so.
Right. So I couldn't, but most people could. But that's the point of that safety. And then just for your point, real quick, where the septic tank is, that's a lot of people's problem. Septic tank in the back, sewer in the front. Plumbers, galore.
Yeah, a lot of people are solving that problem.
Okay, do we hear a motion?
In the matter of 7 Doan Road, swimming pool variance for where 20 feet is required, this would be and 30 feet is proposed, a variance of 10 feet. Given the fact that there will be additional safety measures in place, alarmed gating, cameras, and an automatic pool fence, pool cover, I propose that we accept this motion.
Second.
John Smith motion and Sims second. All in favor?
Aye.
Aye.
500. Thank you for coming in.
Thank you all very much. I appreciate it. Thank you.
Agenda item number 4 is the opioid settlement listening session and results. Alex?
Hello.
You?
Good. How are you?
Great.
So actually, Joe Morrissey from Crescendo Consulting Group was going to attend in order to present her findings.
There's one in participants. Or is it us?
Analyst. That's
Analyst.
Peggy.
We don't have any attendees.
I'm gonna send her a quick email, but
Yeah, but we can,
maybe we can circle back if she jumps
Want
on.
to go to
yeah.
agenda item number 5? 'Cause that's in your Billy. Okay, anyways. Okay, short-term rental regulations, draft discussion.
Yay.
Oh, yay.
I know. Are you guys excited?
No.
So, back in August, the board may recall that Elizabeth and I were here to discuss short-term rental regulations. And since then, there's been quite a few discussions, research, and number crunching to determine how exactly we can move forward with this regulation. So in your packet today is a draft short-term rental regulation. What I'm hoping is that the board can provide some feedback. I can answer any questions the board might have, and if the board is pleased with this draft, the next step will be to take it to town council for review. And the draft you have in your packet is we're not the only town looking at short-term rental regulations. Some towns have already put these into action. So what the board has in front of it is kind of a combination. We looked at several different towns, including Mashpee. We met with Mashpee. They have kind of a similar setup to what we will end up having here, where we have the rental registration, which has kind of been in play for a little while. And then on top of that, we will have a short-term rental regulation to start anyway. So this is a combination of some different regulations that already exist, and I'm hoping that the board is happy with it.
So
John?
why are we doing this? Not in like a flippant sense. I mean more of a
I know.
regulation sense. Why are we doing it? Because
Health and safety, because there have been some incidents in town and also just, not just in the town of Orleans, but as a whole, that we would like to ensure health and safety of short-term rentals in our town and have an inspectional schedule set up so that we can have a representative from the town get into the rental and do an inspection, mostly under the state housing code, but also on behalf of the building department and the fire department, so that we can make sure everything's healthy and.
Will they have to publish or put out the letters, the certificate?
Yes.
As we do in restaurants and,
Yep, they will need to apply. This will be an annual thing. They'll have to apply every year. Hopefully, we'll get going with an inspection, an annual inspection, where they will then receive a certificate that will have to be posted.
And in section 5, if you're looking at
Yeah.
the rental regulations, that's kind of where it talks about what information needs to be on the certificate and that it needs to be posted.
so there'd be a maximum number of people allowed in each. So this goes back to something that was happening years ago, where we would get a complaint about a particular rental unit. And the owner would evict the person before the inspection would happen, so they would not be allowed, we didn't have the opportunity to go in and take a look at something, correct? Yeah, well, Bob, we had several,
Some of those were also long, summer help.
Summer help.
You know, when the J1s are here, and that's not really what this is
Right.
regarding.
would
but-
that also apply to J1
So-
types of housing? And
This specifically would be short-term rentals, so the rentals you see on Airbnb, VRBO, all those.
be more than 31 days.
But
Yes.
eventually, having a rental program, we would like to look at those situations as well. And I think the evolution of this regulation would be that we'd move in that direction where it's a comprehensive rental regulation. And we have the staff to do inspections of all rental units. But certainly, I mean, the health department we still field complaints. We haven't gotten those in a long time, but certainly the short-term rental ones in the summer, we spend a lot of time on those. And some of it's overcrowding, some of it's, I mean, any other.
Trash.
Yeah.
so who's the enforcement agent in this particular case? Would it be a Department of Health employee, or, okay. so-
Yes, the idea would be to hire a full-time inspector.
Okay. And that cost would be borne by the fees that are.
Correct,
that
yep,
are created through this program.
yes.
Okay, got it.
And this would be applicable to all short-term rentals, even if represented by a local agency?
Correct.
Is there an issue with recognizing this use when it's not recognized by the zoning table?
That would be a question for zoning. I mean, we can certainly have Elizabeth come back to have more of a discussion on, especially if we're in favor of this draft and moving in that direction, we can have Elizabeth and anyone else the board would want to ask questions to. I mean, this is going to be, there are gonna be multi-departments involved in this program. Certainly the building department, new rules have come out from the state for their building code regarding inspections of rental properties. So there's a lot of different players, definitely.
No, I wonder what the snowball effect is with the, especially the rule, I think it was Judge Vay's ruling on the Nantucket. If it's determined to be a primary use of the property, it's not on the zoning table, which it isn't,
Right.
then you need a variance, which you can't get, a use variance. So it's a non-allowed use, and we're regulating the not allowed use. That's where's the snowball stop, I guess? It is zoning change, and is this circumventing the zoning change, which will be a problem, because it's gonna be a town meeting thing, people will feel regulated and all.
Well, and in some cases, it could be defined as a commercial use, depending on the type of rental. If it is prone to being used as an event space, then that is a different use than strictly residential. And that question has cropped up before.
Yes.
I do think as we get to some final answers on this draft, and I think this draft is fine, I think it's sufficient to go to town council, but it needs to go to town council with the questions that have been asked, both today and previously.
Yep, I agree. That's one of the questions I'd like to ask town council also. There have been so many changes. This is a very hot topic, short-term rentals, and I feel like it's changing constantly, so.
Yeah, it seems like it's barreling toward special permits. But I don't know that.
So who actually has to vote for the regulation for it to go into place, other than ourselves?
Just the Board of Health.
Just the Board of Health?
It would be a Board of Health
So
regulation.
it doesn't have to go through town?
It doesn't go to
town
town
meeting?
meeting.
It doesn't go to the selectmen?
No.
Now, we make sure that they're aware of it, of course.
Yes, and this is coming from direction from the town manager's office to explore, that's what started this, to
Okay.
explore this topic.
If you want to dig into that, Mr. Smith.
Okay.
The reason this is an elected board.
Yes.
As opposed to an appointed board, is that we have the authority to promulgate regulations without the consent of other boards.
Power in your hand, John. I think that that's my only concern on that. Like, what is the regulatory stop there? I don't think there's any, from our charge, health, safety, and welfare, makes sense. Even if you disagree with it, it makes sense. I think that some of those problems were from long-term rentals, actually the biggest problem.
Right.
So I think, I don't know, I know so I have a couple where I write in, I do the yearly thing, or whatever it is, you register it, say what it is, but I don't know I don't think there's been inspections. I mean, they're welcome to, but.
Nope.
You know.
The origins of that registration was kind of to start to get a handle on just how many rentals were
We're here.
here.
Yeah.
Which, it's certainly helped us get some numbers. But, right, it doesn't, there's not much to it. It's just a registration, and it doesn't say anything on top of the responsibilities that already exist for different departments to ensure health and safety. So,
There's a certain amount of ensuring we consider the unintended consequences.
right.
So would you like the motion to move this to town council, or do we want to get answers first before?
I think I would make a motion that this draft go to town council for their consideration,
Okay,
to be accompanied with the questions that have been asked at this table
okay,
today, and also questions that have been asked previously, such as what constitutes a commercial use in a residential district, and it does this in any way allow that sort of use.
okay.
And even if not a commercial use, if a primary use, is it primary or commercial? But
Yes.
that's the problem. It's not, regardless, it's not on the table of uses.
I'll agree with that. Those are all questions that should be asked.
Okay, perfect.
I can elaborate. I'm sure some.
We know you can.
Second,
All in favor?
Aye.
Thank you.
I meant later. I could say again what I said.
Fantastic.
Great.
All right, back to agenda number 4. I see Joe Morrissey's here.
Yes, and while she checks in, I just wanted to say that, so Joe Morrissey is here from Crescendo Consulting Group to give the board a presentation on the community engagement project we did. And just to remind you, this was funded with the opioid abatement money. So, Hi, Joe.
Hello.
Hello, and thank you for having me here today. I apologize for being tardy. When I heard I was item number 4 on a community meeting, I assumed I had a little more time. You guys move faster.
We're very
than I
speedy.
anticipated. You guys are speedy.
Very efficient.
Efficiency. I love that. Well, let me help add to the speediness then. So I have a very brief PowerPoint presentation with visuals that hopefully will help us move the discussion along. Can everyone see my presentation?
Yes, thank you.
Wonderful.
Thank you.
So I'm Joe Morrissey. I'm the director at Crescendo Consulting Group, and I want to present to you the findings from the opioid settlement regional and needs assessment that we conducted last fall. So this presentation will give you a brief introduction, a history of the opioid settlement, some payments and expenditures to date, the settlement agreement overview, the methodology we used to conduct this assessment, the key findings, prioritization, and proposed next steps which are under discussion. Excuse me. So the regional participants include Brewster, Chatham, Dennis, Harwich, and Orleans. They came back to Crescendo. We had been doing work within the region to do a regional health needs assessment prior to this opioid needs assessments, and it just seemed like a natural flow to continue working within your communities with the addition of the town of Dennis. The impetus was that we all know that opioid use disorder does not know municipal boundaries, and that together these communities can address a much more stronger response using their opioid settlement dollars than they could independently. So a brief history of the opioid settlement dollars for those who may not be familiar with this. Back in 2018, the then governor and attorney general were one of the first to join up in suing the manufacturers and distributors and the owners of the patents for the opioid use disorders, OxyContin in particular, that really were at the heart of the spread of this opioid epidemic that took the country and still continues to take the country by storm. They were successful in having not only be the first, but in joining in most of the other states in suing these, a full range of manufacturers as well as pharmaceutical companies and distributors, including and I'm reading my notes here, Johnson & Johnson, Teva, Allergan, Walmart, CVS, Walgreens, Kroger, Cardinal, McKesson, Amerisource, Bergen, and other manufacturers. So this has been a ginormous effort. Those first payments, they prevailed, as well as the others, and those first payments started rolling out to municipalities back in 2022. Today, we're looking at 5 towns that are, again, looking to regionalize and perhaps settle in on an intermunicipal agreement on how best to pool their fundings and address their regional needs that we discover. The final payments from these suits are scheduled to continue through the year 2038. And I also just want to point out 2 important things at this juncture, looking over the history here, is one of the first to be sued was Purdue Pharma and the Sackler family. And they were also one of the last lawsuits to be finally settled, and they weren't really settled until just this past January. And that is the largest of all of the lawsuits. So moving forward, when I'm sharing these numbers do not reflect the Purdue Pharma nor the Sackler settlements. And one last thing about the funding that I'm about to share with you is there is a funding formula that has been set at the national settlement agreement level, and many municipalities, especially in this region, there are towns that receive multiple times the amount compared to the town right next door, and that is really due to that formula that was set in the settlement at the national level, and it's really out of the hands of each of the states when they are distributing those funds. So with that in mind, these were payments that had been received and expended as of November in the fall of 2025, and they again do not reflect the expenditures and payments that have been received or sent from the Purdue Sackler settlements. So as you can see here, Orleans is one of the smaller of the bunch in their receipts, but really their total estimated future payments combined are upwards over $1 million over the next few years in the region. So in order to receive funding from the Massachusetts Settlement Agreement, each municipality needed to sign such an agreement. These agreements reflect input from these agreements ask municipalities to share these commitments in how they are stewards of these funds. It should reflect the input from the community, address disparities, address poor mental health and substance use, supplement, not supplant existing programs and services, and encourage innovation and fill gaps. These settlements go on to outline 7 overarching strategies. Each of these strategies have associated activities that are otherwise known as allowable expenses. So opioid use disorder treatment, support for people in treatment and recovery, connections to care, harm reduction, address the needs of criminal justice involved persons, support pregnant and parenting women and their families, including babies with neonatal abstinence syndrome, and prevent the misuse of opioids and implement prevention education. So this slide does need a little bit of updating. The expenditure dashboard for FY25 has been posted, and I apologize, I didn't go back into this slide deck that was created back in February. That dashboard has been since updated. So ignore that blue QR code in that link, and I can send you an updated QR code and link to the FY25 dashboard. It does, the dashboard does provide a little bit deeper look into the amounts received and how municipalities have expended their funds to date. And if you really just want to see the payment schedule, what is already been received and the anticipated future payments, you can use that green QR code or use that link to pull down an interactive Excel spreadsheet that you can then look at each of those payments received and future payments to be received by municipality. And then finally, that black QR code, the Massachusetts State Subdivision Agreement, or that link, you can, if you're suffering from insomnia, pull down the entire state subdivision agreement and read it through from start to finish. So the methodology that we used in order to learn more about the root causes of the opioid epidemic and what the people within your communities who have been impacted by the opioid epidemic see as some of the root causes. So that was the purpose of this methodology. So during the fall, we held 5 town hall sessions, one within each of the partner municipalities. And then we also sent out valid survey responses to all of the community members within these 5 towns. These surveys were purposely targeted to be sent to organizations who either represent or work with or are members of communities who have been directly impacted by the opioid epidemic. So we're talking about family supports for those who are living with or have survived a loved one from an overdose, or living with someone with a substance use disorder, and supports that are in the community, such as recovery centers and treatments, with the intention of really getting at the purpose for these funds, which is to abate the harms caused by the opioid epidemic by those who are lived or living these experiences. So what did we learn? I'm going to walk through the major buckets of findings. The first major bucket was treatment. So within your region, there is a lack of 30-day inpatient treatment programs. Many people reported needing to travel off the Cape and go over those bridges to find programs that were unique or could meet the needs of someone who is suffering from an opioid substance use disorder. There is a lack of follow-up upon release from incarceration or treatment and or detox programs within your region so that you can continue on your journey to recovery. There was a reported lack of quality and experience among primary care providers to identify and assist the patients who are presenting with opioid use disorders or even substance use disorders within their practices. Likewise, there was a lack of support or lack of services to help support those with dual diagnoses for mental health and substance use disorders. One of the biggest themes throughout is the cost to those who need to have access to any of these services. Many of the aftercare services are not covered by insurance, and yet that recovery journey is just as important as seeking the treatment itself. And then again, along treatment, that sort of stigma that folks have always reported in terms of stigma that they experience in trying to speak with healthcare providers about their substance use disorders, and then for those in the community who are on medication-assisted treatment, which are life-saving medicines that help keep them as productive citizens of the community. Another major bucket is along the same themes of treatment, but are distinct to recovery, and that was a lack of sober housing, transportation supports to get them to and from both recovery and treatment appointments. Again, lack of follow-up upon release from incarceration, treatment, or detox. So for those that have been incarcerated, they are also sort of, I guess you could call in a cold turkey treatment program, but upon release to try and keep them free from substance use disorders, they do need those follow-up supports. In the recovery realm, there's a need for self-care training to transition from using substances as crutches to then substituting some of those turn to behaviors, those triggers to keep them sober. So nutritional counseling, stress management, physical activity, mindfulness, and acupuncture can help replace some of those behaviors with positive behaviors, and help them on their road and staying on the road to recovery. And again, you can see here, people also mentioned a lack of insurance to keep them in those recovery spaces. And then support for needed services above and beyond the physical, which is sort of the environmental. Many of the folks who have coming out of recovery or even out of incarceration are facing maybe employment records or that don't necessarily support them in seeking new employment, the need for job training, for housing, counseling, legal services. Again, those other sort of softer but very much needed supports to help keep them in a positive space within the community. And then finally, the last two buckets here of findings include the need for social justice workers or social workers to work within the law enforcement realm. For instance, co-responders to an overdose, for either those who survive the overdose and or their family members who would like to support that family member in their recovery, or for family members who are faced with the worst predicament, which is what next after losing someone to an overdose. Interestingly enough, the other theme under law enforcement was the judicial response being too lenient on drug dealers. And then support again for those criminal justice involved individuals upon leaving incarceration, because indeed for many leaving incarceration, they are highly vulnerable to experiencing overdoses and falling back into old patterns that got them in trouble to start with. And then that last bucket here was the family and community support for those services for family members who are impacted, who are loving or mourning the loss of someone with an opioid use disorder. And again, the prevention, the availability of Narcan within the community, and education around not only the opioid epidemic and how best to support people who are living with substance use disorders, but the whole spectrum of how we got here and how we can get out of this current situation. That's what sort of fell under that education bullet. So, taking all of these factors into consideration, we held a prioritization session on December 19th, 2025, where 23 participants representing municipalities, key partners, and those with lived and living experience looked at all of the data that we presented that you just saw, reviewed findings, and prioritized these 16 identified needs. We used a modified Hanlon method where each participant was asked to rank each of these 16 identified needs in terms of magnitude, severity, and feasibility. And then we took each of those and weighted feasibility to try and determine which order was most important or prioritized in your community. Because as you all well know, you can't do everything at once. You can't do a mile wide and an inch deep. You won't get the results that you need. You really need to focus your efforts where you feel you can make the most difference. That said, these are the results of each of the findings in ranked order. I will pause while you read the list yourself. I will not torture you with trying to read it. So the proposed next steps are still...
Is it possible to ask a question before you go off that slide?
Absolutely.
Along with the ranked order by the individuals, by the participants that were at the meeting, was there any costs put down against each one of these? Like, how much would they anticipate it would cost to run a program for opioid prevention for youths? How much it might cost for Narcan use training? Any of those particular categories have a cost estimate associated with them?
You are asking the best question ever. The short answer is no. The costs were not considered quite yet in the process. We are taking a stepwise approach by taking one step at a time. Identifying the needs and then ranking those needs in order is an initial step. Getting to that sort of monetizing, okay, what will this cost us? So there's further refinement. And indeed, the cost question is what does come next? Does that answer your question?
Yes, it does. And one other thing, some of those don't require a particular cost. For example, the one at the bottom, increased consequences for drug dealers. The district attorney for the Cape and Islands, I've forgotten his name, Gelboy, was just yesterday in a meeting, was talking about how they had put together programs to make sure that drug dealers upon bail hearings are not allowed to have bail. They are immediately incarcerated and kept in prison until their time for trial. So there are ways to help with those particular categories without having to put a significant cost against them. But have you shared this with, say, the district attorney's office or any of the other law enforcement agencies in this area?
We have also not gotten to that step quite yet. Also another excellent question. And it's really good to hear that the district attorney is thinking proactively about their role in addressing the opioid epidemic and substance use disorder within their community. That's impressive. And I completely agree with you that not everything here needs a cost associated with it. Even some of the Narcan use training may be programs that are already being provided by the state. It's just a matter of inviting those programs into your community.
Okay. Okay,
Any
onward.
other questions?
Oh, please continue.
Okay, thank you. So the proposed next steps, this is, again, this is under discussion, but, and it doesn't have to necessarily be one way or the other, but just to step back and talk about process. When it comes to creating and monetizing a plan that is as emotionally charged as how to address the opioid epidemic within your community, where there are people who have been directly impacted by the horrible consequences of what happens in your families and with your neighbors, it is important to move quickly to get these funds out to where they need to be. It is also equally important to be as transparent and inclusive as possible in making the decisions about how those funds are spent. There will always be detractors to say that they don't agree, or you've moved too fast, or I didn't know. I don't need to tell you that. You're sitting on a municipal board. I've sat on my municipal boards as well. No matter how many meetings that you hold and no matter how many times that you propose plans to and flake them out to have people respond to them, there will always be people who come to you after the fact and say, I had no idea. But you at least are able to show in those circumstances that you have conducted your due diligence and you have done everything you can to solicit input and be as transparent as possible. That said, this is sort of the gold standard, and it doesn't necessarily need to be as, my apologies, it doesn't necessarily need to be as thorough or as detailed as this. So walking through some of these proposed activities for strategic planning, speaking to the sensitivity of people not wanting to be left out or future asking questions, who made these decisions, the creation of an opioid strategic planning charter so that you outline how decisions are being made and who the final decision makers are with the power to make those decisions is something that I do recommend. The other recommendation is to recruit a strategic planning committee. It could be simply members who have already been involved with the assessment activities so far. It could include members of the community who are also representatives of or are direct members of communities who have been directly impacted by the opioid epidemic. And then together, collect and analyze secondary data related to opioid use. Where are these pockets? Where are these overdoses happening? Where are these arrests happening? Where are the hotspots? Maybe take a look at where exactly on a map some of these treatment or recovery centers are located, so you can get a fuller view of exactly what assets are already in the community and identify the gaps. Hosting a workshop where you share the results from the assessment as well as the asset and gap analysis on the environmental scan, and then begin really reviewing and refining a draft strategic plan. And then once you've got this strategic plan in place where you have identified which activities that you really want to do, at that point is where you may want to then start looking at, well, what will these cost to actually implement or open a recovery center, or do training with physicians, and who's going to do those trainings and how you do those trainings with physicians, and is there a cost that's associated with that, and to bring them up to speed and address the concerns of their patients who are suffering from opioid use disorder. And then once the discussion really now is, do you come up with a strategic plan that's been monetized and then create an intermunicipal agreement, or do you already set up an intermunicipal agreement to share funding and then find out how much each of these things are going to cost? It's a chicken or the egg at this point. I recommend finding out how much things are going to cost, and then how much each municipality is going to contribute to those costs, and then build your intermunicipal agreement based on that understanding. But it can be done the other way as well. And then finally, once everything is in place and you begin implementation, you do have pretty stringent reporting guidelines for the state. So setting up those key performance indicators that are required for state reporting and pulling those together and helping each of your municipalities report on how you've used the funding and what outcomes that you have been able to achieve. Again, this is just a draft, it's a proposal, and it's up for discussion actively right now with each of the 5 municipalities. Pausing for questions.
Questions? Sims?
So the thought that communities sort of determine how much they would contribute to the group effort, that suggests that some funds would be retained for the municipality to address specific efforts outside of the consortium of communities.
That is a possibility.
I'm not seeing quite yet how a community would determine that it has a need greater than what the consortium has arrived at.
Yes. There are no rules of the road here, so this is a unique opportunity for each of your communities to sort of have those difficult conversations amongst yourselves. As you bring back this slide, as you can see, there's a wide variance among each of your municipalities of how much money they have to spend. And so far, everyone I have heard from does not have any agenda in mind of keeping any of the funds, but that doesn't leave out the possibility that someone, once we get into planning, may see that there's another unique need that does exist within their community that may fall outside of what everyone agrees to pool their funding to support.
We've already spent $40,000 because we had needs that need to be immediately met by our own community, so that might happen again, you know? It just
You know,
depends.
It just depends. And there may also just be, you know, do you prorate this? Does everyone put in everything into the bucket? Do some municipalities want to hold some of that funding aside, maybe to have specific bucket of funds like for those who have lost someone to an opioid overdose to help them pay for, you know, death expenditures. You know, some towns have also done that. There's no rules here. So it's just a matter of having good faith going into these discussions and coming out with what's best for everyone.
Thank you.
You're welcome.
Got a question for you, for the,
Sure.
if, you know, like, there are nonprofits in the area that handle, you know, food distribution. So, and they receive a lot of funding from individuals as well as from different organizations. Is this particular fund allowed to accept donations from individuals? I mean, if somebody wanted to, you know, to donate, you know, does it have what is it, a C3, I've forgotten that.
501c3 or?
501c3 designation that it could be a charitable giving?
You mean if we were to have an intermunicipal agreement?
Right.
Oh, I have no idea.
Okay.
My gut tells me no.
So you only
But-
only state funds can be used on state programs, is that it? You can't contribute to a state program?
Are you asking how an individual, if they wanted to contribute to this effort,
Right.
how could they
How
give
could they
that money?
possibly do that?
I would think we would need to ask finance, because I don't know how the town accepts gifts off the top of my head.
I mean, because I can't believe that there's enough money to do anything remotely enough to fully fund any particular program. So how are you going to make up the difference, you know? And you might as well plan ahead for it now if you really, really want to make a difference in the opioid treatment area around these communities.
One possibility would be to use these funds to seed to seed as in seed, S-E-E-D, hard to make sure you're understanding my vocabulary, a small nonprofit that would act as a recovery center that would then become its own entity that could be continually supported as a sustainability plan for that center. That's an option.
That's interesting.
Creating something perpetual beyond 2038.
Yeah, like using these funds to seed something that then becomes its own thing is a possibility.
It's a thought,
Yeah,
Yeah.
that's a big picture.
yeah.
Well, that's great. Is there anything today that, I'm not voting on anything today, this is just a back and forth.
Nope, yep, this was
Listening
just
session.
an update, so that the board would know all the work that's been done and the results that have come from that.
Fantastic.
So you're going to other boards, but is it going to be shown on anywhere else in the greater universe? Like on a website or?
The slideshow there,
Yeah,
we can absolutely share it online. I think, as long as that's okay with Joe, it's her, presentation.
Alex, I did record this presentation for the town of Dennis, and I believe I shared the link or the file for that. But if you, or it could just be the static PowerPoint presentation. That
Yep.
can also be shared too.
Okay, yeah, we can look into that.
By virtue of being recorded within a public meeting.
Yeah, I was gonna say, this
Here we are, yes.
Joe, I have one, it might seem a minute question, but it raises a question in my head. In the surveys were distributed to those who had some sort of connection or response within the wider opioid issue within the municipalities. I noted that, much like the money, it doesn't really track with population. Specifically, Brewster had 82 responses and Dennis had 24. Is that because there are so many more engaged individuals in Brewster, or are there active programs in Brewster that don't exist in other municipalities?
Really good question, and boy, are you an astute observer. The survey was distributed not only amongst municipality connections, but really what we tried to do was partner with nonprofits that are serving this community of people who have been impacted by the opioid epidemic. So that question about demographics, where do you live? It could have been someone who's working at a nonprofit agency in Harwich, but they lived in Orleans, and so they checked Orleans. It's an imperfect measure of the disbursement of the survey.
When we've partnered with other Lower Cape communities on initiatives like this, Brewster does tend to get a higher turnout. They push out their messaging on, I don't want to say it's an emergency platform, but they have it's easier for them to get information out by virtue of whatever they use,
So
in my experience.
So the high number of responses may simply be the mechanics of the distribution and not necessarily.
It may have been more
a
people
connected responders.
Solid and Brewster, yeah. That's kind of been the pattern since I've been working on the Lower Cape. Brewster gets a lot more participation. We're very jealous.
Well, we don't have to reinvent the wheel.
No, we don't.
Thank you, Joe.
It's been my pleasure. Thank you for your flexibility this afternoon.
Thank you for coming today.
Thank you.
Thanks, Joe.
Thank you.
All right. Wow. Wonderful. We'll get an update
Mhm.
down the road as that progresses, I hope.
Yes, absolutely. Thank you.
Thank you.
Thanks for coming today. Moving on to agenda item number 6. Meredith?
Yeah, so I wouldn't encourage you guys to look at all those pieces of paper I gave you in the packet because it's going to be a lot of gibberish, but I can give you the highlights of each temporary food permit. We have a number of them on the agenda today. The first up is the Orleans Firebirds concessions. There are 19 different event dates of when they will be having a concession to coincide with their games. Similar to years past, the menu is going to include things you would see at a standard sporting event, the hot dogs, hamburgers, nachos, pizza, etc. They're going to continue to use the Nauset Middle School kitchen to store the food, and they're going to cook the food to order on site. The person in charge, Susan Murray, has all the necessary certificates to be able to handle and serve food properly.
Move approval?
Second.
John Smith motion and John Kanaga second. All in favor?
Aye.
Next up, there's going to be an event at Seaside Cannabis on April 19th where Mom and Pops is going to bring their mobile food truck to serve food items like hamburgers, hot dogs, and French fries. They do have a passing mobile food truck inspection and all the required certificates needed to be able to handle and serve food.
Move approval.
Second.
Is that John Kanaga this time?
Correct.
The opposite way around. All in favor?
Aye.
Aye.
Aye. Keeping you on your toes.
Next up, there's going to be an after-hours aquaculture event that's going to take place at the Lower Cape TV building at 5 Namaskakit Road on April 22nd. This event is in collaboration with Canteen, which is a licensed food establishment out at Provincetown, and Mermaid Menu with local aquaculture shellfish growers, Calliope and her husband, Michael Shute. The menu is going to include things, mostly oysters, shucked and stewed, kind of as an education event for people. And they have all the required food handling certificates.
Move approval?
Second.
John Smith motion, Sims second. All in favor?
Aye.
Next up, keeping in the theme with shellfish, there's going to be a raw bar at the Town Cove Tap House April 24th. The application was submitted by Cam and Tyler Hadfield, who own the rail and Barley Neck in town. They are familiar with keeping shellfish safe. They're going to be keeping it on ice under a tent to limit sun exposure as much as possible. They know no bare hand contact and to keep the shellfish tags on site for 90 days and are very familiar kind of with that process and have all the necessary food handling certificates.
Move approval.
Second.
John Kanaga motion, John Smith second. All in favor?
Aye.
Mr. McGrath abstains.
401.
Last up is the Orleans Firemen's Relief Association. This is an event that takes place every year, so you may be familiar with it. It's going to be taking place July 5th at the Orleans Fire Department. It is a nonprofit event, so a food protection manager certificate is not necessarily needed. However, we have been working with people in charge of the event, and they are working toward taking at least the food handler course and have taken the allergen awareness course. Menu items are going to include breakfast items like pancakes and sausage, so relatively low risk foods.
Move approval.
Second.
John Kanaga motion, John Smith second. All in favor?
Aye.
Hey, that's all I
Agents
have.
Report.
Not a lot of exciting stuff going on. We're very much in kickoff to summer. Heather's here today, but she's been doing a lot of our pre-opening inspections at local seasonal restaurants and motels. John Nelson is very busy responding to any calls, questions, inquiries regarding the Phase 2 sewer connection letter that did go out April 31st. Over 424-ish, I believe, certified letters had gone out in the mail, and we've received, I wish I asked John for an updated number, but many applications because he's been on the phone all day and doing lots of outreach with individuals. I know, for example, he's going to stay late tonight, 5 to 7, to meet with individuals who might not be able to come during the day, who might have questions, so that's moving right along.
Excellent.
Thank you. That's great. Anything else for us?
Not at this moment.
Adjournment?
Future items that we, for coming up that we need to do?
We are going to be circling back with the short-term rental regs once town council takes a look at those. And if you guys had any additional questions or comments, feel free to email those to me. And Alex and I will get them all together before we pass it to town council. I still would like to pursue reaching out to community partners to kind of see what their pulse is on Kratom and what interest there might be in having a regulation surrounding that. And I do know tobacco regulations. We would like to bring those back in front of you. It's really just a matter of Alex and I going back through them because we haven't looked at them through last fall and making sure all your questions and comments were
Are there any
addressed.
articles in the town?
That we submitted? No, not from the health department.
Are there any that we need to worry about?
Oh gosh, I need to read the warrant myself, so I don't know. Putting me on the spot.
There's a couple big ticket items, but there's no,
But there's,
health, safety, and welfare. I suppose the fire station is kind of health.
It might
safety
be
and
health,
welfare.
safety, and welfare.
But other than that, which is Article 17, I think it's the third one after the consent agenda.
after the consension.
Oh, good. Sims?
It just occurs to me that the health agent might want to ping the chair of the Board of Selectmen to see if the board has in its collective historical memory any issues relative to short-term rentals that they would like to at least be part of a conversation, if not addressed directly. And, understanding that short-term rental regs as being proposed by, as currently in draft form, have a specific aim and need to stay in that lane. But there might be some outside thoughts that should be part of the tangential conversation.
Sounds like a plan. I can do that.
Move adjournment.
Second.
All in favor?
Aye.
Aye.